Oh, that's weird. I saw the mic icon go off, but now I still can't hear you. Hold on, let me make sure it's not on my end. I just lost. Oh, okay, I just logged in on my phone. Let me see if that'll work. Okay, can you hear me here? I still can't hear you. I don't know why. Let me see. But you can hear me though. Okay. I don't know. I can see your lips moving, but I can't hear you.
Can you hear me?
Yep.
No?
Yeah, I hear you
You
now.
can?
Yes.
Oh, okay. Whew, okay. A little technical difficulties, y'all. We okay. We okay.
It's
We
all
here.
good.
Okay, now let me see. If I mute myself,
I don't hear you now.
I keep hearing an echo. Can you hear me?
Yeah, I can hear you.
Okay. I think I know what to do. Hold on.
Okay.
The echo is. Can you hear me? Say it again. Say
Yeah,
something.
I can hear you.
Okay. Okay, I know what to do. Okay, great.
Okay.
Okay, sorry. Sorry, viewing audience. Okay, so we're just going to get started since we're running a little bit behind. And I'll just give the introduction. I'm a little bit about myself. I'm Dr. Camilla, Dr. Pharmacy. I am a natural birth advocate as well as a breastfeeding advocate as well. I am a wife. I am a mom of three. I have had one home birth, one assisted home birth, and one unassisted home birth on accident. And then I've had one birthing center birth as well. I also am just an advocate for just a mom giving birth the way that she wants to, regardless of how that may look to someone else. Every mom's birth is going to look different in some aspect, but I do believe that education can lead to better birth outcomes, especially in the Black community, regarding maternal and infant mortality and death rates. So, one of the ways that I have given back to my community is to raise awareness about the Black maternal and infant health mortality rates, and to also teach them different things that they can do to have better birth outcomes. So one of the ways is introducing a birth team and to know who should be on your birth team. And so I did want to have this dialogue per se with Dr. K, um, just because I'm an advocate of birth and a birth that every mother may envision for herself. So, just a little bit about her. I'm going to just introduce my special guest today. We have Dr. Kayla Williams with us. She is from Little Rock, Arkansas. She is a native, and she's dedicated to chiropractic physician as a chiropractic physician. Sorry, excuse me. She has a strong academic and professional background. She earned her bachelor's of science in biology from Philander Smith College in 2009 before furthering her education to the University of Arkansas for Medical Sciences of Public Health program. She later pursued her doctorate of chiropractic degree at Logan University in St. Louis, Missouri. Shout out to St. Louis.
Hey.
Graduated in 2014 during her training. Dr. Williams gained a valuable experience interning during her rotation at St. Louis Veterans Hospital, East End Chiropractic, and St. Louis Acupuncture Clinic. In 2016, she expanded her expertise by learning a Master of Science in Nutrition, which we are going to have her back to speak in that realm in some aspect. Dr. Williams also began her chiropractic career in her hometown, where was recognized in 2015 Little Rock winner for, I'm not sure which award this is, Choice Awards in chiropractic care. She later relocated to Atlanta, Georgia, where she currently resides, where her practice at Atlanta Spine Center in 2016. A committed professional, Dr. Williams is an active member of uh, of the American Black Chiropractic Association and Delta Sigma Theta sorority Incorporated. She is also Webster certified, which we'll get to that in a second, specializing in chiropractic care for pregnant patients, guys. So let's give her a warm round of applause.
Yay.
Thank you for doing this for me. I found you actually through a page. One of she may be your friend, Christy.
Okay.
Yeah, and so I just wanted to reach out. I do believe I have a strong belief in your doctor should mimic how uh, you are, and so especially in the Black community, having a doctor that looks like you is very important. That understands you is so important, and your background and where you come from. So that's something that we try to enlighten here and explore motherhood. So thank you for joining me.
Absolutely. I'm happy to be here. I
Yes,
love this.
ma'am.
You're doing good work, girl.
Yeah, I shouted out St. Louis because I'm from all over the place. I'm originally from Houston, Texas,
Okay.
but I have lived in St. Louis, Missouri, probably for 7 years out of my lifetime,
Hmm.
and so my whole family is there. So
Okay.
shout out to St. Louis, the 314. So
So where are you
yes,
located now?
ma'am. I'm currently back in Houston.
Okay.
Yes, but I went to school in New Orleans. So
Okay.
yes, so went to Xavier University
Nice.
of Louisiana. So we're just gonna jump right in, if you
Okay.
don't mind. So I just wanted to ask you if you can explain the role of chiropractic care supporting maternal health during pregnancy, and even before pregnancy, if you want to touch on that.
Mhm. So absolutely. So we definitely get this question a lot because a lot of people want to know,
Hmm.
is it something that I should do during
Right.
pregnancy or is it something that's safe to do during pregnancy? And
Hmm.
the answer is absolutely yes.
Hmm.
Um, so, in general, what chiropractors do is we treat the musculoskeletal and nervous system.
Okay.
And we do that by basically correcting what we call subluxations, which is basically just restrictions in the spine um,
Hmm.
to reduce interference on the nervous system. So essentially, what that means is we just make sure the body is functioning properly, so that
Mhm.
wherever those nerves go to can function the way that they're meant to. And we
Right.
do that by removing interference. When it comes to pregnant women specifically, we focus a lot on the pelvis
Yes.
because
Hmm.
if you think about it, that's where the baby resides, is in the pelvis, and you're going to have a little bit of interruption in the natural integrity of the pelvis because of the hormone relaxin.
Right.
So, relaxin does exactly what it says. It relaxes the ligaments and the joints around the pelvis, so so it can move properly while the baby grows. But what happens when it does that? When it gets, I call it soft for lack of a better word, it's going to cause some misalignments, which in turn will cause some discomfort during pregnancy. So that's where we come
Hmm.
in. We basically correct those misalignments to give your body basically um, the best chance of being in the
Right.
right position for the baby to grow and to be delivered.
Right. Okay. So how far along, like, is it immediate, or like how early in pregnancy should someone consider
You can
incorporating
come as
chiropractic
early as
care?
possible. Like you can start first trimester, but ideally you want to get in there by week 32. So what I
About week
do with my
32.
patients is similar to you going to the OB. So when you go to the OB, you're only going about once a month for the first
Right.
trimester. You're not seeing them as often, but as you progress, we ramp up those visits to get you ready for delivery. So
Okay.
for shortly
32
after
weeks.
32 weeks, you need to be in there.
Okay. And just to give you some insight on why I wanted a chiropractor to talk about being on a birth team, I feel like it's necessary for a couple of reasons, like you said earlier, to open up that pelvic region
Mm-hmm.
and get the baby down into the correct position.
Mm-hmm.
From my experience as well, I've dealt with a chiropractor for all three of my births.
I love it.
Um, and it would, I'm not sure what week it was for each one, but well, actually, for the last one, I can say it was actually 40 weeks.
Okay.
And so, yeah, I'm not one that's immediately attracted to an induction. And
Mm-hmm.
so I wanted some alternative way to get me where I needed to be, which is to
Mm-hmm.
start labor.
Right.
Being so late in, late in gestation. So,
Mm-hmm.
how can chiropractic adjustments contribute to a safer and more comfortable pregnancy for mothers and then to a birth?
It can make it more comfortable. Now, what I don't want to do is make promises I can't keep.
Right.
But so about 50% of pregnant women have lower back pain or
Hmm.
sciatica, or
Hmm.
even if it's not back pain or sciatica, they might have acid reflux. They might get
Yes.
headaches. A lot of them get numbness and tingling in the wrists and hands or carpal tunnel from pregnancy. So what we do is basically, like I said before, we remove the pressure off of those nerves. We're gonna balance that pelvis out
Hmm.
because the nerves that come out of the lower back, they're gonna travel through the lower back and go down through the back of the leg, and that's what causes the sciatica. So we're gonna make sure your pelvis is balanced, get those
Hmm.
joints moving freely, so it'll take the pressure off of those nerves and gives you some relief.
Right. Right.
Sometimes it can give you a lot of relief.
Relief. Yeah.
Yeah, but not all the time. Like pregnancy
Right.
is pregnancy. But
Right.
what I don't like is when um people will tell you, or even OBs will tell you, oh, it's just a part of pregnancy, it's nothing you can do.
Right.
When there absolutely are things you can do, because we're gonna work on the muscles, the joints, the ligaments, we're gonna do stretching, we're gonna do muscle work, we're
Hmm.
gonna do everything we can to put you in the most comfortable position as possible.
Position. Hmm.
Hmm. But you can't take medication. You can't take
Right.
pain medication.
Not many.
So,
Right.
yeah.
Hmm.
So and Tylenol probably isn't doing much for you. So
Right.
I just want people to know you do have an option to get some relief during
Some
pregnancy.
relief.
Mm-hmm.
Yes. With my second child, during my second birth, um, I had what is it called? I think it's pubic symphysis
Mm-hmm.
dysfunction.
Yep,
And oh my gosh,
it's painful.
it was, I could barely walk.
Yeah.
Okay. So that's how painful it was. So with him, I'm sure I did an earlier visit. I believe I started at 30 weeks with a chiropractor,
Mm-hmm.
if I'm not mistaken.
Mm-hmm.
And it was a lot of relief
Yeah.
because, and they give specific technique. Well, you all give specific techniques
Mm-hmm.
that you need to keep up during the pregnancy to maintain that level of, I call it walking on clouds.
Yeah.
Because so even with getting out of the bed, there's a certain way you should do that, or
Mm-hmm.
sitting down, or how you should be sitting.
Right.
Getting into the car and out of the car was some techniques that I could remember her explaining to me.
Mm-hmm.
And all of those things were getting my pelvis out of alignment.
Yes, absolutely.
um so I am so grateful for you all
Yeah.
because that pain is like no other. And then I will even say with my daughter, my last daughter, um, after giving birth to a 9 pound baby, 9 pound, 3 ounce baby,
Mm-hmm.
and I'm small, I'm 125 pounds,
Yeah.
small frame, 5'1".
Mm-hmm.
So I could barely walk.
Yeah. And this is
I
the
could,
one you had at home.
yeah, and I had her at home on
Mm-hmm.
a three floors, apartment.
Mm-hmm.
And my goodness, had to go up the stairs after giving birth.
Right.
Coming from the hospital after we, had the baby, we came back from the hospital to make sure she was okay. And going up those stairs, and I could barely walk.
Mm-hmm.
And knowing that I had I think they call it PSD, with my other child, I'm like, okay,
Mm-hmm.
this is what this is, and there's nothing you can do about it. Literally, you
You're
have to
right.
you have to wait until the relaxing goes away.
Yeah.
You have to wait till that goes down.
Mm-hmm.
So I'm thankful for you all.
Yeah.
So if we could talk about some of those specific techniques or approaches that you
Mm-hmm.
use to help align the pelvis. I know I mentioned during reading your bio, the Webster technique.
Mm-hmm.
Can we get a little bit more information about what that is?
Mm-hmm. So the Webster technique is a chiropractic technique that is designed specifically to adjust pregnant women.
Mm-hmm.
You talked about your pubic symphysis being in pain. So when the
Mm-hmm.
pelvis does get out of alignment, it will affect a few ligaments and joints around the pelvis, and the pubic symphysis is one of them. So the pubic symphysis is the joint right in the front of the pelvis, and that those two connect together. But if you look at, so this is what we do as a Webster. I'm gonna use my hand. I
Yeah.
am Delta, but I'm not.
Yeah.
So
Yes, ma'am.
but think of this as like your uterus and your pubic symphysis is in the front, right? So
Okay.
this is why she was teaching you how to get in and out of the bed, in and out of the car, because you want to keep it everything aligned like this. But if
Mm-hmm.
it gets out of alignment and does like this, but you see how much space you have here.
Right.
But if it rotates to one side
You
or the
get
other
less
too long,
space,
the space is going to get smaller. Now
smaller
the baby doesn't have room to
room.
move and
Mm-hmm.
maneuver the way that it needs to, for one. So now I know we talk about discomfort and symptoms during pregnancy, but for me, the most
Mm-hmm.
important part is delivery.
Yes.
So
Mm-hmm.
I don't have children, so I know women like, you don't understand. Like I don't
No.
understand. But I can imagine the worst
The
part,
pain.
the most
Yeah.
important part is the delivery, and
Yes.
you're not gonna be able to sleep for the next few months anyway. So
Anyways, yeah.
I'm not sleeping now, but you
Exactly.
know.
Mm-hmm.
But what we do is we make sure that pelvis is exactly like this, and that baby can travel through the canal
Through. Hmm.
um, very easily, or as easily as possible. So, and they do have studies that say that women who have had chiropractic care during their
Care.
pregnancy,
Hmm.
their labor
Is
is
shorter.
shorter.
Hmm.
Yeah. So
Yes.
the Western technique does just that. It just makes sure that pelvis stays aligned, and you have to
Right.
train the body to stay
Yes.
that way. And you're
Yes.
fighting against relaxing, and you're fighting against this
Yes.
growing baby. So it takes,
Hmm.
and that's why we say like 32 weeks. We need you in there because after
Right.
35, you don't know
What's good? Yeah,
what's happening. Like
exactly.
that baby's coming at any moment. Like
Yeah.
we know some people go past 40, which I know. Listen, when I tell you my pregnant women, 35 weeks, they are done. Like they're like,
Yes.
get it out. I'm over
No.
it.
And that was another reason why okay, so with my first daughter,
hmm
um, it was during Hurricane Harvey. I'm not sure if you're familiar, but in Houston, we had this big hurricane. I
hmm
think it was a Cat 3 or something. It stayed over the city for a long time.
hmm
And so when I was about to give birth, there was no hospitals open. They were taking, they were only taking if it was an emergency. They didn't deem pregnancy as an emergency or giving birth as an emergency. They were taking people who were diabetic. And I
Yeah.
called the police department, called the fire department to see, like, just in case I couldn't get to the birthing center, because I
hmm
did have a midwife.
hmm
But just in case I couldn't, could I go to the hospital?
Right.
Because, we didn't know where the water was and all of that. And she told me, she's like, you're going to have to go to a chiropractor. This was before the storm,
hmm
to make sure that you're you're aligned enough for the baby to come out when it's
hmm
time, because we're
hmm
not going to have time. We need to make sure the baby's going to be able to come out. We
We're
don't
like,
have
speed this
complications.
up.
Yeah, we're going to have to speed this up.
Yeah.
Yeah, and I will say, right after that, right after the chiropractic adjustment, maybe, okay, that was at 3 o'clock. Was my appointment. I think it was 12 at night.
hmm
I lost my mucus plug.
Yeah.
And for the people that don't know what that is, I guess it's basically the thing that's it separates the baby from the cervical canal. So
hmm
it keeps the baby from getting in other infections.
hmm
So um, I lost that. So that means it's go time for most
Right.
people.
Right.
So for most people, it could be days or even a week later after you lose your mucus plug, just to keep that clarified.
Mhm.
But for me, it's always been go time
Right. Right. Right.
because I've always done my chiropractic adjustment. So that means something is about to happen.
Right.
So right after that, I had to go in. Um, and we waded through the water to get to where we needed to go. And I think it wasn't that night, but it was the next night I had my daughter. So
Okay.
it wasn't as long. The first child, they say, is the longest labor because you don't
Mhm.
know what to expect. You don't know what you're doing.
Right.
With my son, after the chiropractic adjustment, he was the easiest birth. He came out in 4 hours.
Okay.
So my daughter, she was real fast. It was about 1 hour, but it was hard to me because it was, I
Yeah.
wasn't with my midwives or anything. There was no one there. So
Right.
it was hard mentally, I guess, per
Yeah.
se. And then after she came out, it was just nothing. So that made it worse, I guess.
Mhm.
But
Yeah.
it was a smooth labor. I will
Okay.
say that.
Yeah. Yeah.
But yeah, so it does play a role in reducing those risk of complications in labor and delivery,
hmm
because you are, like you said, you're widening that. I'm not trying to do,
Yeah.
not trying to do it the other way. Sorry, you're widening that
That.
that area for the baby to come out.
Mm-hmm.
And you're allowing that space for the baby to properly shift and rotate. That was another thing.
hmm
The reason why I started the chiropractic care in my situation, my baby was sunny side up.
Okay.
So she had to get the baby to flip.
Mhm.
toward my bottom. His face needed to be toward my bottom
Mhm.
to come out properly without that many complications.
Right, right, right.
Yeah.
Yeah.
So
But
she
that's another
was,
benefit they say of
yes,
Webster.
yes,
We can't say we turn babies because that's
right,
prejudice.
but y'all do
Yeah. We have seen babies turn.
turn. Yeah, yeah,
Um,
literally.
but
Hmm.
we're not sticking our hand up anywhere. It
No,
literally like just think about the pet. Like if it's like this and the baby is trying to turn this way and
turn.
it's
You
bone, right? Like
can't.
I can't
Right.
get there.
I
So
exactly
that's why, a lot of times they do, or they don't flip the way that they're supposed to.
supposed to.
Also,
Hmm.
babies are gonna do what they want to do.
Gonna do.
So
True. Hmm.
I don't want women to feel like they did something wrong or something
Hmm.
was wrong. Like I did all because I had
I've done
one,
everything.
yeah,
Yeah.
I had one who was gun ho on having a home birth,
Hmm.
and she got to maybe 8 hours,
Yeah.
and he just was not moving.
Yeah.
She was at home. He wasn't moving. The pain was just,
But still there.
yeah. She
Still
was
a
like, it was
lot.
just unbearable, and she was
Mhm.
just hard on herself about that. I'm like, listen,
Yeah.
those babies gonna do what they want to do.
They're gonna do what they want to do.
They gonna come out
Yeah.
when they feel like it.
No, right.
We
And no
just put you
situation
in
is the
the,
same.
yes, exactly. Don't
Hmm.
look at other people's story. And
People.
I'm like,
Hmm.
I've been practicing 10 years. I've been doing
Yes.
Webster for about 4 years, but I've always treated pregnant women.
Yes.
But um, I haven't had two stories be the same.
Same. Nope.
So you can't like
Yes.
look at a have a plan.
Have a
Be
plan, but
open.
just be okay to the plan going a different way. And so
Exactly.
that's another thing that we do advocate for in Explore Motherhood. We
Mhm.
of course want zero complications,
Right.
but sometimes
Hmm.
it's not gonna look the same.
Right.
It's not gonna look the same. All we hope for is that mom and baby come home okay. That's
Most
it.
importantly, that is it. That is the
That's
only
it.
thing.
Yes, ma'am.
I'm like, we will put you in the most optimal position
Right,
for
right, right,
everything to go smoothly.
right.
If it doesn't, it is okay.
Okay, it's okay. Yes, yes,
Like, you
yeah.
did great. Y'all are here. Like,
Right. Yes.
so
So, what type of advice would you give to an expectant mother, particularly in the Black community, who may face systemic disparities in healthcare?
my biggest advice, and I tell all my patients there, um, or I tell all my patients in the office, is have an advocate. Have somebody
Yes.
there that will advocate for you. Have somebody there who knows you. Because
Right.
what they do is they minimize symptoms still, even
Yeah.
knowing that they had these type of
Hmm.
stereotypes or opinions around it. It's like you don't want to do better.
Right.
Because
Exactly.
I have one lady now who goes to a particular hospital, which I usually like, and she's like, they just rush you off or blow you off, and they're like, "Do you have any questions?" And I
Right.
ask my question, and it's just like whatever.
Yeah.
Luckily, I know her. Her husband comes to all of her appointments with her,
Hmm.
so he's very aware. He's very
Right.
verbal.
Right.
Everybody does not have a supportive
That.
partner like that.
Right. Exactly.
But if you don't have a partner or a husband or whoever that
Hmm.
knows you, like bring mama, bring sister,
Someone.
bring best friend, bring somebody who knows something is not right with her. I need you to look at this. And if
Right.
you blow
Exactly.
them off, or you are the patient off, or the lady, you have somebody that's gonna raise hell. Like,
Yes.
no, look at this and look at it now. So that's my thing. Just
Absolutely.
have somebody that, or have a midwife, or I mean, not a midwife,
Doula.
a doula.
Yeah.
Get a doula.
Yeah, we advocate for doulas. There's many laws that are being passed that have allowed doulas to be present. If you may have low income, you
Mhm.
can also get it through your insurance, and there's different ways to go about that. But having an advocate is something that you definitely need,
Mhm.
especially as a first time mom.
Right,
First, someone
right,
first giving birth the first time, you need someone there with you.
right.
Um, because I would just say in general, you need someone there with you in general. Because even me being a doctor,
Uh-huh.
even me knowing the medications,
Mm-hmm.
even all of it,
Uh-huh.
in the moment, you're so emotional.
Right.
You're so out of self, or you're so in. You go into yourself,
Mm-hmm.
and you can't even, like, for me, I'm a person that goes into myself when I'm giving birth. So I don't want to
Mm-hmm.
hear, see, think. I can't think
Right.
for myself. I can't
Right.
do anything for myself. So to have another ear to say, oh wait, no, she said she wanted to wait
Mm-hmm.
until this occurred for
Right.
that to be administered, or
Right.
whatever it may be.
Right.
You need someone that has your best interest in mind,
Mm-hmm.
um, and to say, well, I know you said you wanted to do this, but they're saying this is happening now. Can we
Right.
go ahead and do this now?
Right.
Yes, because it makes sense.
Mm-hmm.
So whatever the situation may be, where it's I want to do it or I don't want to do it, or
Right.
I
Right.
want to do it
Right.
right now, you need someone to remind you of those things
Mm-hmm.
and to be an advocate. Like, can you give her 5 minutes to think about it?
Exactly.
Can you give her,
Exactly.
some time
Right.
and
You're
come back
not a
and we
doctor in
can
that moment.
assess?
You're
Right.
like, I'm giving birth. That's
I'm
what
giving
you
birth.
spend energy
I'm
on.
not none of that in this moment. I don't know what's going on. Okay. I don't know what's going on. Okay.
Right.
So yeah, I believe in having that person of advocacy,
Mm-hmm.
who can advocate for you in the moment. So
Absolutely.
yes, I love that you said that. I love that you said that. Do you collaborate at all with any other birthing professionals, such as doulas or midwives or OBGYNs? Tell us a little bit about that. Um,
More so doulas than anything. I don't know any midwives actually. The
mhm,
funny thing is I got into doing pregnant women because
mhm.
I had one patient who was pregnant and she went back and told her OB like it helps her. Never
Yeah.
met the lady. I don't even
Mm,
know the lady's name.
yeah.
And she just started sending people.
Referring people.
Yes.
Yes.
And I
So
was like, okay, I guess we're doing
yeah,
this now.
yeah. No, that's kind of how I was referred to the chiropractor.
Hmm.
Told the midwife I do Webster technique to
Hmm.
one of her other clients. And
Hmm.
so I told her I was having, this discomfort and all. And
Hmm.
so she said, well, you need to go to this man. Look, and he'll
Right.
give you a discount. Look, he's giving discount to all my patients. So to
Okay.
have that collaboration with her was a
Mhm.
benefit for both of them, because
Right.
she had patients that she didn't have to transfer to the hospital, because they were aligned and were able to have, the
Right.
baby in the correct space in the correct position to optimally get the baby out. So it
Mhm.
benefited everyone. And I do believe that having those different collaborations with each other in the workspace as birthing professionals, that it will help tremendously in birthing outcomes, at least. So
Absolutely.
yes, ma'am. What postpartum benefits does a chiropractic care offer new mothers that are recovering?
I tell women, um, as soon as you're comfortable with getting out of the house,
Yes.
come see me.
Yeah.
Because, and it's the same with the baby. Like the birthing process is traumatic on the body. Like people
Mm,
don't look at that as a trauma, but think
yeah.
of it, it's violent. Like
Yes. It's extremely violent.
yeah. So the same thing, like you said, you're waiting for the relaxing to go away. So
Hmm.
think first you've pushed out a baby or had a cesarean section. So let's stop at cesarean section.
Yeah.
So when you cut where they cut, you're gonna basically interrupt the core.
Yeah.
Your core a lot of times is what keeps your
Okay.
lower back in check.
Another question.
Yeah. So we need to make sure that basically your lower back and your spine is where it needs to be while your core heals, and we have to build that back up. So we do a lot of like pelvic floor and core exercises
Yes.
to basically strengthen everything back up. But it is the same thing with even a vaginal birth. You can have a
Mhm.
disruption in the pelvic floor and weakening of those muscles.
Yeah.
Um, you just see it more with cesarean sections because you actually have to cut through those muscles. But
Yeah.
the focus after having a baby is more of like strengthening um, and teaching everything how to, stay
Stay
stabilized.
together. Hmm.
Yeah. And then for the baby, a lot of people don't think about is coming through the canal or even
Hmm.
cesarean where they're pulling and tugging. They pull from the head typically.
Right.
So we actually adjust newborns and babies to make sure there's no interference in the nervous system after they're born. And that's a thing a lot of people don't know. And no, we're not popping the baby. We're
Baby.
not
Right.
adjusting the baby. It literally looks like you're just holding the baby, but you're actually checking for misalignments and putting a small little pressure on those
Hmm.
joints to make sure that they're functioning properly. But yeah, I recommend all of like bring me the babies because
Right.
and they
Yes,
usually
ma'am.
bring them on their own anyway because they'll get a little fussy and they're like, I don't know
Right.
what's going on. And especially like if they feed, they only want to feed on one side or the other. Like
Other.
they only,
Hmm.
but if you check their neck, it's like they have a spasm over here. Like it
Right
hurts
here.
the
They
leg.
can't talk. They
They
can't
can't.
talk to tell you, look, listen now, I can barely move my head and my
Right,
neck is already kind of loose. So
right,
like,
right.
yeah, I want you mentioned core, and then you also mentioned the C-section. When they cut for the C-section. But I did also want to highlight for some moms who may not know as well, when you have birth vaginally, you still could have a gap in your core
Mm-hmm.
due to diastasis recti.
Yep.
And I'm not sure if you've dealt with moms that have that as well, but
Yeah.
the core is basically obliterated.
Exactly.
And so and
Exactly.
so they have nothing literally for their intestines and
Mm-hmm.
any internal organs that may sit right there to
Mm-hmm.
hold on to.
Right.
Literally, essentially, they're collapsing into the abdominal wall.
Mm-hmm.
And so I wanted to see, had you come into contact with any moms who had that?
Oh, absolutely.
And okay, yes, ma'am. And then the other question I had, you mentioned babies, but then also mentioning children, and this is going a bit more into exploring motherhood down the line, but we talk about we talk about night terrors
Mm-hmm.
and just discomfort and sleep patterns
Mm-hmm.
and how an adjustment may help the child as
Mm-hmm.
well sleep better.
Yep.
um, so yeah, I definitely love that you mentioned that for the babies. I
Mm-hmm.
had never really thought about it for the baby,
Mm-hmm.
but for the child, I've dealt with it a little bit.
Mm-hmm.
So you do babies. How
Mm-hmm.
small or how early can they be adjusted?
We have people that go to the hospital and adjust babies
What?
right after they're born.
Wow.
Now you have to be invited from by the parents. Like you can't
Yeah. The
treat,
doctor, right.
yeah,
Hmm.
as a doctor, but you have to be invited, and they'll go, as a visitor and
Oh,
adjust babies. I
wow.
don't do that, but I mean,
Yeah.
I've seen chiropractors adjust their own baby as soon as they're born.
Yeah.
Um,
Hmm.
so ideally, as soon as possible. The earliest that I've seen was 1 week. Um,
Okay.
he was exactly 7 days. But normally they bring them about 2 or 3 weeks. And that's just simply because they don't want to leave the house. They're like, when
Yeah.
you're ready to leave the
Exactly. Yeah.
house. So again, as soon as you're ready to leave the house, bring them in. We'll just, it's super quick. It's like a 2-minute assessment and adjustment. Like it is very quick.
Very quick. Yeah.
Mhm. But another issue too, and this is after birth or for in a couple of months postpartum, but
Hmm.
if they have digestive issues,
Yes.
same thing with that
Gas.
from gas,
Yeah.
constipation.
Acid
Um,
reflux.
I had a patient the other week tell me, next time you adjust this baby, I'm leaving her here with you. Because
Yeah.
the way she blew that diaper out,
She
it's in the car when she left.
Yes, ma'am. Look, everything had a smooth way out. Look, smooth
Uh-huh.
transition. Oh
Yeah.
wow.
So I think that's the most
Yes.
common issue with babies that see a is usually constipation, and we just work
Constipation.
on basically stimulating the nerve in
Okay.
the sacrum to get it to activate and move, and it will
Move
move.
out.
Yeah.
Oh wow. Thanks for that insight. I had never thought about that. So that would be another, I guess, thing to suggest to moms,
Hmm.
like, oh, because you get a lot of people talking about constipation,
Hmm.
especially with, children that may be on the spectrum
Hmm.
as well. So
Hmm.
that's a great alternative,
Hmm.
to some of the, medications as
Yeah,
well
exactly.
to get
I
it
had a
moving.
nonverbal autistic little boy a little while ago, and
Hmm.
that first visit was what you would expect. It is
Right.
like, who are you? What are
Right.
you
Get
doing to
off of
me?
me. Like,
Like
please.
losing his mind. Like,
Yeah.
I don't know what's going on. Like
Going on, don't touch me.
it
Yeah.
took us about an hour to get through
Hmm.
that visit.
Right.
And I'm not gonna force, do this, just let it
Right.
like it's like we're building trust.
Right.
We're playing, let me see what your limits are. Second visit, a little bit like, what is happening?
Yeah.
After that third visit, he walked in, laid himself on the table, like,
Like,
and just
please.
like,
Take me.
and ever since then, he has been like, he just comes in, lays on
Chill.
the table. That is it. He's
Okay.
gonna do whatever he
Yes.
wants. I don't care. And his
Right.
mom said like he would come every Friday. And she's like, his teacher was like, he is so calm all day, every
Oh,
Friday.
sweet boy.
Yeah. It's
Yes.
just like, because the adjustments do release endorphins. So it makes you feel
Right.
good, feel relaxed.
Right.
So, that's another benefit of children or even like ADHD.
Walking on cloud nine. I'm telling y'all, that's what you're. If you want to walk on cloud nine,
Yeah,
come get a chiropractic adjustment. Literally, my
absolutely.
first one ever, I was
Mhm.
walking on cloud nine. I'm not like how when you first get your glasses and you're not really
Uh-huh.
sure how to step.
Uh-huh.
That's what it was for me. Like, oh, am I actually walking or
Right. You
touching
just
the
feel like
ground?
you floating. I have to
Yes.
show y'all this. I hope it'll show up on here. But this little girl, she had colic when she was a baby. I've been treating her since
Oh
she was
yeah.
probably like 3 months, and she came in yesterday. She's 2 now, but she
Oh,
was the
sweet,
cutest. I hope y'all can see this.
sweetie.
It's like,
Oh,
not today. But she's the
right.
same way. She comes in, just lays on the table, like,
Table. Yeah. Like, please
right,
get me together. Yes,
right.
ma'am. Well, how can my audience get in touch with you? Where are you? If we could reiterate that, what
So
services do you provide again? If we could do a replay.
absolutely. So I am in Atlanta, Georgia.
Hmm.
Currently at Atlanta Spine Center in Midtown Atlanta. Um, you can find me on www.theatlchiro. So it's www.theatlchiro.com.
Hmm.
I am on YouTube at Dr. K. Well, it's Dr. Chiro,
Hmm.
Chiro. YouTube, not YouTube, but Instagram is at dr.k underscore chiro. And I think that's it. My website has online booking. Accept
Okay.
insurance, cash. I do personal injury. So if you're injured in a car
Okay.
accident, I treat those slip and falls. My favorite is absolutely pregnancy and
Yeah.
kids.
I'm glad that it is because we need you guys.
Oh,
Okay.
absolutely, absolutely. And then
Hmm.
athletes. So
Athletes. Okay.
yeah.
Well, great. It was wonderful having you. Is there any last words that you would like to give our viewing audience?
I don't think so. I just want people
Hmm.
to try chiropractors.
Right.
People love it.
Yes.
Like we had a bad rap at one point, and we were
Exactly.
But I think
Right.
we've evolved out of that. If you had a bad experience, try another
Mm-hmm.
one. I always tell people like,
Right.
say like, oh, I went and it got worse. But I'm like, if you went to a bad dentist, you gonna stop going to dentist,
Dennis,
or you gonna
right.
get your teeth
No, you're gonna try a different one,
you
right?
should try a different one. Like
You gotta
your
try a different
spinal
one.
health
Yeah.
is just as important as any other hygiene. So
Yes, it is. Yeah.
just just try chiropractors. We good people.
Yay! Well, yes, I definitely wanted to have you on because I do hear about that stigma. Like, no, pregnant women can't. First of all, can't get an adjustment.
Hmm.
Two, you should. It's making it worse. And for
Right,
me, it hasn't made it worse
right,
at all. I'm not. I mean, I feel like I'm okay.
you're right,
If it did, then I don't know.
you're
I
right.
wouldn't know.
But
But
the problem is, I'm like, even if it did get, go tell that provider. Like we have
go
different
right.
techniques, we have different tools in our that we can use. That technique
You
might not be good for you, so we
you
need to try
right. They
something
need to try
else.
something different.
Yeah.
Right.
So.
Yes, I'm glad we are at least bringing awareness that no, that it is a thing that
Mhm.
can help the mom, and then
Right.
also, to instill in trying a different one, maybe if you've had a bad
Hmm.
position
Absolutely.
provider. So yes, ma'am, thank you so much for joining us,
Thanks for the
and
invite.
yes, we would love to have you back on. I know you probably don't have any virtual services because it's definitely a physical
Right.
um, thing, I guess,
Right.
outside of telling the person the techniques of how to get in and out of the bed and all of that. But
For sure.
yeah, but if you're in the city of Atlanta, we do have some moms in the group that are in Atlanta. So
Mhm.
I will definitely put your information up if that's okay with
Oh,
you,
absolutely. For sure.
for our birthing team so that they'll be able to access you in the future.
Absolutely.
Yes, ma'am. Well, thank you for joining us, and we're going to sign off.
All right. Thank you.
Okay, peace. Let's see. In stream.